Assalamu alaikum to everyone. I hope my sound will be clear for everyone. Before to start our talk today, I would like to present myself. I am Dr. Mazin Abed Mohammed, PhD of Biomedical Computing and Artificial Intelligence. Actually, I am lecturer at College of Computer Science and Information Technology, University of Anbar, Ramadi City, Iraq. Actually, I finished my master study and my PhD study in Malaysia, University Tinaga National and University Technical Malaysia Malacca. Currently, I am associate professor at my university at Anbar at College of Computer Science and Information Technology. Actually, my master and my PhD, actually all of these studies, it's specialized in artificial intelligence technique use. Before to starting our speech about the role of machine learning technique use in medical and healthcare solutions. Before that, I would like to know what's our agenda, what's our guideline or outlines for today. Actually, we would like to take a brief history of AI and machine learning in healthcare. Actually, we would like to discuss and we would like to know why now? Why now? And what is the reason to make all the research, all the studies focus now? This is because the data. When I mean say about data, that's mean the details about the data processing in AI. Actually, we would like to take example in machine learning in healthcare. Actually, we would like to discuss about NQ about machine learning in healthcare and what is the project or the main syllabus can be taken to use AI in this field. Actually, before to starting or to discuss about the history of artificial intelligence and expert system and intelligence system in this domain, we would like to know what's the details or what's the role of artificial intelligence in healthcare. As we know, as the use of complex algorithm and software, in other words, artificial intelligence emulate human cognition in the analysis, interpretation, and the comprehensive of the complicated application. So machine learning or artificial intelligence technique use can be used in healthcare data, especially the ability of computer algorithm to approximate the solution without direct human input. So the first use or applied of the machine learning or artificial intelligence was in Mazin expert system. This one was in 1970. Actually, Mazin expert system for identify the bacteria causing several infections. Actually, the first expert system under artificial intelligence, it was about bacteria causing severe infections. That's why to determine the severity of the bacteria infection on the disease. Actually, in 1970, they proposed a good therapy. It's about 69% of the cases. So when we are, for example, if we would like to compare the effect or the implication of AI and the expert system, you know, it was proposed a good therapy in 1669. It was achieved a very good result. But currently, when we are used, for example, same expert system or develop machine learning or AI or expert system, that will be increase the ratio. So their system, when they propose, actually it depends on the user behavior or the human thinking. Actually, they have description about a new case or new cases. These new cases will be entire for user interfaces. After that, the system, as you know, the expert system have inference engine and we have knowledge base. So they will be share and transfer the knowledge with the information, and that the system, he can be say, for example, this the ratio, this patient have this cases, or not, or we classify the people on healthy people or patient people, same like that. So in 1970, mechanic expert system was the first expert system, or AI application or programs can be used in the medical and healthcare solution. In 1980, actually, they have another model. It's called Intercent 1 QMR model. Actually, this was proposed by University of Würzburg. Actually, this is for a quick medical reference. Actually, it's used for the internal medicine. They use this system or this model for the diagnosis of the internal medicine. Actually, they designed this model or this software based on two criteria, based on the disease and based on the symptoms. So they make like the probabilistic model relation between the disease details and between the symptoms. After that, the system or the model can be diagnoses the patient and give the accuracy or the degree of the patient level. Actually, the problem was the clinicals enter the symptoms manually. So we write, this is expert system, this is the intelligent model, but the problems when we are create or design the software or the expert system, intelligent model, hyper system, as you know, we have a problem because why? The clinicals or the physician, our doctors, they must be entire the symptoms manually. Actually, we have another problems is difficult to maintain, difficult to generalize the system and to make it the system can be adopted with another application or another case study. So, and we are created the first expert system in 1970. It was for bacteria, but in 1980, actually the system rule or probability is different. Why is different? Because adaptive with another application for general disease in medicine, but for internal problems. Actually, in 1980 also they make it automated medical discovery. What we are saying about automating medical discovery, actually they have knowledge or details or information about medical laboratory. This is called knowledge base. This knowledge base, you know, it's already delivered from the discovery model. The discovery models is based on your rules, depends on the hypothesis, based on the medical records, based on the medical experience. Then we have entire data set, our database. This database must be include your case study details, like the disease, like the symptoms, like the therapy, like the medication, the doctor experience. So the data set or database will be record about everything related to the case study and the patient. Then we have the statistical package that we include everything. Then the system will be decide, I mean about the analyze internal medicine to decide what you have. For example, in table 1, we have the hypothetical time-oriented record for one patient. They will have visit number, how many time it's visit in the number. We have the date. We have the kind of the injury, like the knee pain, victims, temperature, diagnosis, white blood current count, and another details. So as we know, this table or this record for one patient, how we are decide or imagine if we have 1,000 people. How we can imagine now, for example, as you know, we have the coronavirus pandemic, okay? So if you want to imagine if you have 1,000 patients or 1,000 visitors in your medical center to check this, this human have infected by coronavirus or not. So the main question or main concern motivated us to develop any expert system, any artificial intelligence system, make any intelligent system, it's data. That's why we are saying, why now? Actually, in 1990, something created and developed. This is by neural network in medicine. Neural network with medicine was created in 1990. Actually, it's moving the thinking or the design of the intelligence system from the manual thinking to automated thinking, and make the system make decision support with high confidential ratio. Actually, neural network with the clinical data took off from 19 with 88 new studies that year. So small number of features as input, data often collected for chart review. Actually, as we know, we have many inputs, for example, patient one, or details for any patient, as I mean the features or the classification of the details. So we have main three stage at the multi-layer perceptron for neural network. This the first two, it's first two layers perceptron with four inputs for hidden layers, but we have only one output layer. This output layer will give you the decision, classify the cases. This cases, it's normal or abnormal. If the case is abnormal, will be classified to healthy and unhealthy, time like that. So for the first design or created for neural network in clinical medicine has making and develop the decision making in general. Actually, in table 1 we have 25 neural network studies in medical decision making. As you know, if you will see in this table, for example, if you are taking the breast cancer, actually the number of example used for the training 57, for the testing 20 samples, and we have another design for the network. How many input layers, how many hidden layers, how many output layers, and we can say the accuracy of the result. This is all these studies we are taking from the history of the artificial intelligence and machine learning techniques for neural network studies in medical decision making in 1990. So the outcome or the accuracy have been increased, expand from, if you want to compare with making expert system with a 98 medical modeling program for analysis or something like that. So the neural, when used in the medical decision making, has increased the ratio, has increased the trust or the validation of the accuracy, something like that. Let us continue about the outline of today. Why now? Our question, as we talk about the brief history of AI and machine learning in healthcare and medicine, let us say why now? Why now? Why now the artificial intelligence have important roles in medicine and healthcare? Actually, to answer our concern, to answer our question about why artificial intelligence now, actually the main things is the data. The data, it's a main important factor to use artificial intelligence, as we know, because when we are saying this intelligent system, this expert system, this smart system, this intelligent system, whatever the code or description, the terms for your system, your product, your program, your software, actually depends on the data, because all the artificial intelligence system, it's learning based on data. Even the data is numerical, text, or image, whatever the sample or example. So it depends on data. How the data can be understanding by our system. Of course, it depends on the human behavior and human understanding, and compare these ideas, these strategies for the computer programs. Actually, we have this history or this literature about the adoption of the electronic health records. EHR has been increased 9 times since 2009. Actually here, as you know in this chart for the percentage of the hospital in USA, actually they mention here in this study the increase the data and the electronic health records for patient, I mean from 2009, sorry, 2008 to 2015. If you want to see the ratio, they starting about 9.4%, right? But in 2015, the ratio about 83. Actually, because this reference I taken from some research he published about this fact. Actually, now I just review and updated the reference. Now, for example, the hospital and the electronic health records in USA now is around almost 100, because they make it everything in the hospital, in everything related to medical enterprise, actually make it electronic. So if you want to interview, if you want to discuss, if you want to see everything about the patient employment, doctors, everything, every data you want to discuss, you will be see from the electronic health records. Actually, as we are saying, why now? Because the largest data set. Actually, some hospitals, some enterprise medicals, some ministries, they make or they create large data set. So what's the meaning or what's the importance why we are collect large data set? Actually, when we are collect large data set for any case study, that's why we'll be make data analytic. So we will be see how many patient visiting you every day, every month, every year, which the main causes, which the critical case can be visited, how many patients can visit you per year, which disease has the major causes, for example, in this city or this country, something like that. So larger data set can be used for laboratory, for the computational physiology, also can be identified health data from a critical patient, actually can be make it or demonstrate for the vital signs, laboratory tests, medical notes, everything. So everything from this data details for the patient, for the hospital, for cities, for countries, can use for artificial intelligence to make easy understanding, to make easy analysis, and to give you direct solution or the decision support system. Actually, as we said, in USA, President Obama and was the president for USA. They created large data set about 1 million person research cohort. Actually, the core data is the baseline health exam, clinical data delivered from electronic health record, and healthcare claims and laboratory data. Actually, that was the main aim from creating this data and supported by American government, actually to provide all the details for the patient, which main causes, which is the main symptoms, for example, for about this disease, and to create large data set to distribute the patient based on the province, based on the city or others. Actually, the diversity of the digital health data, actually depends as we mentioned about lab test based on the vital signs, as we show in the figures, based on your image, based on the drum music, based on the devices. So we have different digital health data. Some researcher working on medical images, as this is my specialized. Another one is based on the proteomics, some based on the lab tests, some working on the phone, some on the vital signs, or some based on the devices. So we have different digital health data. This depends on what you want to use or you want to study. Here actually we have the standardization, the diagnosis codes based on the most browser for international classification disease. So They classify the disease based on the importance, based on the majority, where's the bipolarity, something like that. So every case, every researcher, every reference, every referee, actually they classify each disease with some codes. For example, the mental disease, for example, the disease for the nervous system, disease for sense organs, and the digestive system, gonadal system, and the complications of the pregnancy and the children, something like that. So, as we say here, the animal gelatin actually depends on your data set, depends on your large data set. From this data collected, you can easily classify which the number one of the disease can, for example, affected on human life. So one of this reason for collect large data set. Actually, as we have mentioned about the diagnosis codes, about the international classification, actually we have mentioned about the laboratory test. For example, LONIC codes, about the pharmacy national drug codes, unified medical language system, UMLS, millions of medical concepts, and like that. Actually, as we are mentioned, why now about the artificial intelligence and why artificial intelligence in medical and healthcare solutions? Why now? The second reason after the data, actually the algorithms or techniques. As we want to know the advance in machine learning, major advance in machine learning and AI can be classified learning with high dimensional features, and we have some supervised and unsupervised learning, and we have modern deep learning technique that's be used based on the trained models or trained models, and we have another thing, the democratization of the machine learning. It's like a high quality open source software like Python, Scratch learning, TransferFlow, Dino, other software can be used, for example, in data mining like Orange, Weka, Simulate software. We can call it open software, open source software. Actually, the industrial interest in AI and healthcare. As we are saying in the machine learning and the advanced machine learning, deep learning technique use technology can be save lives and help to detect terrible disease early. Why? Because as we said, we have big data and we have analytic data and we have large data set. So the algorithms can be learning, can be training itself, and can be easily to save life by helping to detect curable disease early. As we are used now, many machine learning or deep learning or artificial technique use can be used for predict the coronavirus, even either that use be by the medical image for CT scan for the lung, or by using data analytics for laboratory data set or laboratory test, something like that. So you would like to talk about the example of machine learning in healthcare? Actually, the example of the machine learning in healthcare. Actually, one of the important things of machine learning or AI in the healthcare can be used for emergency department. Why use artificial intelligence technique use in healthcare? Firstly, emergency department, because the emergency departments, the vital department in the hospital, have limited many problems or limitation. Firstly, limited resources, time sensitive, and a critical decision. So, for example, each emergency department, the critical cases go directly for the emergency department. Limited resources, because, for example, we have for example, each emergency department, for example, have 100 cases or 100 tables. This is just for the critical cases. But if we have something happen emergence, actually we have limited resources. Actually, the time is sensitive because limited resources, limited doctors can be distributed for all the cases. And also some cases, it's critical. So it's difficult and critical to make decision about it. This case need surgery. This case need, for example, do some clinical decision. So this department is highly recommend for artificial intelligence or the expert system. We would like to discuss or to show the data in emergency department. So when we are said data in emergency department, actually we would like to say about electronic records. For example, for over 1 or 200 or 300 visitors per week, per month, per year. So actually what we have technical information, free text. We have medical comments, free text. We have the specialized consultants. We have physics documentation. So we have lab result, we have repeated vital signs for each test. We have a lot of things. How to make system can be collaboration and can be collect all the data and save it for per patient. And how make a system can be retrieve the information and system reuse and can remind you about the details of a patient. So it's a huge data. If you want to take example, electronic records over 3,100 patients, for example, per month, per year, whatever the time or period. Okay, how come we can collect it? How we can organize the data? How we can classify the data? How can I refine? How can I reuse? How can I decision support? So the system or intelligence system or intelligent data set, the database, the decision or the clinical support system can be used to refine this data. Actually, when we are saying what's the opportunities for the machine learning? What's the opportunities for machine learning? Actually, the targeting of clinical pathways contains specific delays and risk stratification and improvement in clinical documentation. As we are saying in the previous slide, actually we have many lab tests, many documentation for the doctor, medical, surgery, what call it the type of department. So for example, here in this example or this health record, if you want to say, this is your records from you are beginning or visit the hospital until you have the decision. So it's very dangerous to keep it hurriedly or to review it manually. That's why the system can save it easily and can give you the details for the system very quick and task. Actually, the opportunities for machine learning, as we are saying in the targeting of the clinical pathways, actually they design system. This design system, for example, this is the system for American government. They designed this system to enroll your pathway or your line. To detect your decision support algorithm or system can determine this patient may be illegal, the attributes, features, choose from the following tasks. So it's easy to determine. So the contents of specific display, as you are full all your details for your blood, your temperature, your gender, your name, your age, everything. So the system or the contents specific display based on the user, based on the expert. Just the user, he or she want to display how many patient visited per day, how many patient, for example, for cancer department, for surgery department. So we have refined and specified the display based on our records. Actually, the risk stratification, like with the mortality or to display early detection, severe spaces, which disease can be infected based on the human life, something like that. So machine learning can provide everything about targeting clinical pathways, contains specific display, risk, just stratification, improve the clinical documentation to display what we are. Actually, as we are saying, we have system for detection and classification. Also, we have system systems for real-time prediction can be used in emergency department based on the history of the patient, the history of the symptoms, and what you have, and the system easily to determine or predict you have these cases or not. Now, as we know, currently we have the coronavirus pandemic. Actually, when you are visit the doctor or hospital or enterprise medical, they will ask you, you have temperature, what is your temperature? You have cough, you have flu, they will ask you about the symptoms. So this will be matched with the system design. The system can easily to predict if you have or not based on the majority of the symptoms. Actually, we would like to take the opportunities for machine learning, how to improve clinical detection. As we have here some examples of the workflow, have chief compliance agent of lab prediction team. Actually, the system can, after, as we discuss or explain, how to review the symptoms, the details from disease. So it's easily to predict and to give the result. This is we have decision support system to help the doctors. Actually, we have this chart about the percentage of the standardization chief complaints of the disease. As we are said in 1/1/2010, I mean about the drop down list of no prediction. And now, for example, about the increase the ratio is on the enables of the nurses, of the doctor, and the use of the chief complements. So if you want to see the role of the artificial intelligence in medical, we would like to make it zooming out about the patient before and after 10 years. So for example, about demographics data, when you are collect about the patient, age, gender, status, lifestyle, company costs, and like that, and also about the medications, details, how you are used, the quantities, service providers, data of to fill. But if you want to see the collaboration with the system, what we can you give you medical claims? Can you give you details about yourself? For example, if you want to visit any hospital, if you want to visit any doctors, and you are usually visit this center, all your records, all your tests, or your lab test details have been provided. So the doctor easily to determine your case, easily to evaluate your health. So here we would like to discuss about, for example, each patient have drug A and drug B. The time for the drug. So usually before, when any patient go to hospital, the doctors will just try, and depends on the experience if he remember or not, he give you this medication or not. Now, as we are saying, the rules of data and the algorithm, and to save all the details for patient, so have different way to facilitate the details of the patient. We would like to see what is the NQ about machine learning in healthcare. Actually, what make healthcare different? Actually, the life or the death decision. How to make healthcare different? Actually, firstly, life or the death decision need to robust algorithms or methods. Secondly, to check and balances to build details about machine learning development can be used for different applications. Actually, need to fair and accountable algorithm. Many questions about unsupervised algorithm actually is to discovering the disease subsets and to answer questions such as the characterized the type of people have high likely to be readmitted at hospital. Actually, many of the questions we want to answer are causal. For example, naive algorithm use of the supervised machine learning and is sufficient. Why? Because naive Bayesian mostly is working about the text data, and this algorithm very active in this domain, for example, but it's difficult, or we give bad result on insufficient outcome when we are applied in, for example, in supervised or unsupervised data. So often very little label data set like the clinical data or clinical natural language processing that is motivated semi-supervised learning algorithm. Actually, sometimes small numbers of the sample in rare disease or rare data set make the systems or the diagnosis difficult. So we need to learn the system, learn the algorithms. So we need what we need more data. This data currently in AI is make some technique like data augmentation. Data augmentation means to generate data from self data. So for example, if we have 10 cases or 10 images, actually we can create data from itself data. So this is whatever the algorithm or machine learning or artificial intelligence in general can be generate data to make the learning more data. And also sometimes we have a lot of missing data during the intervals, during the training, will be not executable or not we understand the details. Actually, we have one of the difficulty of de-identifying the data. We are need to data sharing agreement and sensitivity. We have the difficulties for development the machine learning commercial electronic health records because some softwares it's protected, so it's difficult to collect the data. So it's difficult to make the algorithms or the machine learning or artificial intelligence methods in general difficult to modify. Usually data is not recognized, need to more interpretation, and the progress of it's very slow. So we need to be careful. We are testing and iteration is needed. So we need to be focused about the kind of data we are using. That's why now in machine learning and artificial intelligence, when we are collecting the data, we are use big data or large data set, we need to make data pre-processing to filtering the data, to enhance the data, and to remove unobjected or unobject data, or to make balance and filtering for useful data. Thank you a lot for your attention. I am glad if you have any question. Welcome.
Thank you very much, Doctor. The floor, we open the floor for Q&A, please. So if you would like to ask any question, feel free to interact directly with the doctor. Please authorize Engineer Majid to speak.
Hello.
Saudi Mobile Show, please authorize Dr. Engineer Majid to speak.
I didn't hear you well.
Yeah, thank you very much for the this comprehensive presentation. Actually, you mentioned in one of your slides, I don't know, maybe the second one, something related, you put it as an example related to SDG. So can you elaborate more about this SDG regarding to machine learning?
Actually, I didn't hear you well. Can you repeat your question, please?
Yeah, I come across through your presentation because it's very quick and very, I think it's slide number 2 or something. No, after that. More. No, more. you mentioned SDG, which is Sustainable Development Goals. No, not that. No, more. Yes, go ahead. Go ahead.
This one?
No, go ahead. It's in the left side, actually. More. Next. No, next. Yeah.
You mean SGG?
So this
one,
is
right?
major advances in ML and AI, modern deep learning techniques. Example, you mentioned variants of SDG. So can you elaborate on this, because it's not clear for me?
Actually, SGD algorithms. This is SGD algorithms. It is called the static gradient descent algorithm. It's alternative method for optimizing an objective function with suitable smoothing properties. Actually, this methods or this technique used in machine learning, it's a new methods for data science or gradient descent algorithm can be used for classify the object or the many classify the classes based on the nature of the components of it. For example, if you want to use it, for example, in Parkinson's disease, this algorithm or this nature of algorithms can be used easily to classify the patient healthy or unhealthy.
Yeah.
This algorithm actually static gradient algorithm can be used to classify. It's same other algorithms, but actually it's working for alternative method for optimizing and make based on the objective function.
Okay, thank you very much.
Welcome.
Any other question for the doctor, please? Anybody has any other question? It seems there is no question. Thank you very much, doctor, for
Most welcome, dear Prof. I am very glad to share my talk with you, and we hope we can deliver our talk and explanation well to all the audience.
You have done beautifully. Thank you very much. We look forward to further collaboration with you, doctor.
Inshallah. I wish you and your organization community all the best, inshallah.
Thank you very much. We are so proud of all the presenters and of you. Thank you.
Thank you. And we are happy to join this webinar and to deliver everything. Thank you.